I think if it makes sense, let's start with how the gut and the brain are connected.
Okay.
Since that's kind of a key component to a lot of this. It's important for people to note that the gut is basically covered with something called the enteric nervous system, right? So this is the neurological system that covers basically every square inch of the digestive tract from the mouth all the way down to the bottom. And the enteric nervous system is the second most number of nerve endings next to the brain, even more than our spinal cord itself, which was always thought to be the most complex part of the central nervous system outside of the brain. But as it turns out, the enteric nervous system is actually closer to the brain than the central spinal cord is. And the enteric nervous system is, of course, as I mentioned, connected to the digestive tract, which means that all the microbes that live in the digestive tract, which is tens of trillions of microbes, have access to this enteric nervous system. And this enteric nervous system is directly connected to the brain through a bidirectional pathway called the vagus nerve, right? So there's a deep neurological connection between the brain and the gut. The brain can send signals down directly to the gut, and the gut can send signals directly up to the brain through this bidirectional highway. Beyond that, there's a number of other things. One is through the immunological pathways, right? So immune responses in the gut have a direct impact on the brain, even pretty deep recesses in the brain, areas like the hippocampus and amygdala and so on. So we see that in the research. And of course, we come to find out a few years ago that the brain has its own lymphatic system, right? So we know that immunological components that are generated often in the gut and or adjacent to the gut can make their way into the brain. Histamine is part of that story as well. And then there is the standard circulatory system, right? So nutrients and postbiotics that are absorbed from the gut, postbiotics being compounds that are made specifically by the microbiome, things like hormones and peptides and so on, get absorbed into the circulatory system and through the circulatory system into the brain as well. So there's a number of ways in which the gut directly influences the brain. And of course, the brain has a direct influence on the gut. And we are caught kind of in the middle of this continuous gut-brain conversation. And ultimately, as it turns out, the thing that becomes the most toxigenic effector of the brain is the gut. So over time, as you look at brain-related dysfunction, so whether it's cognitive decline or conditions as severe as Alzheimer's or Parkinson's, other central nervous system disorders, or even the things that we deal with on a more prevalent basis like anxiety, depression, and so on, all of those are driven by a dysfunctional gut. The studies are pretty clear on the root causes of all of those things. So it really, we can't overstate the importance of understanding the gut-brain connection and, what compounds like histamine and brain-derived neurotropic factor and inflammatory cytokines derived in the gut, how all those affect the brain, right? So that kind of gives you an overview of what the brain and the gut, how they're intimately connected.
So I'm always about basics and fundamentals so people don't get overwhelmed. So it's a nerve, first of all. And it's a very important nerve because it comes directly off of your brain and in the back of the brain. It's called a cranial nerve. Cranial just means head, skull, whatever. Comes off a particular part of it called your medulla. You can think of it as basically your brain stem. I don't want to get too far into the quicksand here, but you've got 12 cranial nerves. You actually got 24 because you have 12 on the left and 12 on the right. And the vagus nerve is cranial nerve number 10. It's called the wanderer or the vagabond because it pretty much influences everything in the body and travels the longest distance in the body. It is also really important in relationship to the lungs and the guts. It's actually called the pneumogastric nerve. So pneumo just means lungs and gastric means gas. So it's a huge player in your ability to breathe and have gut function, right? And it's the most important nerve in your whole body without question, in my opinion, and I think based on research for this particular reason. It's the most powerful nerve to control what they call the inflammatory reflex of the body. How well you can manage inflammation, how well it turns on, how well it turns off, and how well it adapts. So that's important. It's kind of like the breaker switch or the dimmer switch, if you will. And if there's an issue with that nerve, you will have inflammation of some type, right? And you're supposed to have inflammation because that's what keeps you alive. You need inflammation. Inflammation is not the enemy. It's only when that inflammation just goes crazy or it doesn't know how to turn itself off. And that's usually when you need to look at the vagus nerve to do that. So the vagus nerve is part of what they call the parasympathetic nervous system. So let me explain what that means in relationship to the opposite part of the nervous system, which is called the sympathetic nervous system. Most people have heard of these terms, but I'm going to keep it basic. You need to think of them kind of like a seesaw of one person on either end of the seesaw going up and down, and they play nice together. The sympathetic system is the one that most humans are stuck in because that's the default switch. That's the survival switch. That's the fight or flight response where you do anything and everything possible to not die, right? And the sympathetic response kicks off that inflammatory response, and stress kicks off the sympathetic response. And you can't stay there for a long period of time because you'll break yourself down. So you have the opposite side called the parasympathetic nervous system, and that's the relaxation one. That's the growth and healing mode. The wine, dine, they call it the wine, dine, feed, breed. Have a nice meal, have some conversation, maybe have some sex, all those things that's going on. That's when you heal. And the vagus nerve is the primary controller of that. So if you have good function of the vagus nerve that they call tone, right? Vagal tone. And it's easy to think about what tone means by thinking of tone in a muscle that you have. You could have a muscle that has low tone and you know it. It's just like soft. It's just like no strength to it. It's called loosey-goosey. And then you have other ones that too much tone. It's like in spasm and it's cramping and it's super tight. And then you have in the middle, a normal tone that's that way. So the vagus nerve typically does not function as well as it could, which we'll get into why that might be. And it has low tone. Low tone means it just doesn't signal as efficiently as it could, right? So it works, but it doesn't work as well as it could. So arbitrarily, I'm going to say instead of sending 100% of a signal, it's sending 50%. Okay. So it's there, but it's low tone. And when that happens, then you don't have balance with the sympathetic because the parasympathetic is supposed to offset the sympathetic. But now it can't. So basically, you're always stuck in the on switch of the sympathetic mode. And that breaks down the body. That breaks down mentally and physically and what they call catabolism. You just start to eat yourself from the inside out, basically. And you could eat yourself mentally as well because your brain just never shuts off, But I know I went over a lot there, but basically it's, to sum it up, it's the most important nerve in the body because it controls the inflammatory reflex, how you handle and respond to inflammation. And all disease processes are because of an inflammation. And it's the number one nerve to help decrease your stress response and put you into a parasympathetic state so you can optimally heal. So it's really super duper important, man.
Perfect introduction. And I'm really glad you brought on the term tone, because that was going to really be one of my questions. I did a webinar recently for our customers on non-dietary solutions to IBS, and kind of started that webinar by talking about research showing that those with irritable bowel syndrome, but also inflammatory bowel disease, a good subset of them have low vagal tone. That can be then seen if you're doing kind of HRV tracking, that they're in that kind of sympathetic dominant state. So what you've seen, it kind of completely ties in with what we've recently been discussing about.
So tone is basically resiliency. If you have good tone to a nerve, you have resiliency, which means the pendulum can swing a lot of different ways. It can go up, but it can come back. It can go down and it can come up. That's what the heart rate variability is. Can you go up? Can you go down? Or are you stuck low, right? Or are you stuck high? That's basically what it is. And if you can get that optimal tone, then you have more resiliency, which means you can adapt to the stressors of your life in more effective manner.
Okay. And you've mentioned a few things there in regards to what the vagus nerve does, such as being that kind of inflammatory conductor, for want of a better term. And you've mentioned that it kind of wanders around the body. It kind of innervates all of the different organs in the body. And it is kind of a key part of the gut-brain axis. And I was just looking at some papers, getting my head in gear for our conversation. And one of the things it mentioned that the vagus nerve sort of modulates is sweating. So would I be right in saying, a lot of clients are the cold ones in the room, they go into saunas and half an hour later, they're still not really sweating. Are those certain signs and symptoms that maybe there's something going on therefore with the vagus nerve?
Yeah, it certainly can be, because you're going to be dealing with the nervous system pretty much for everything, with the sympathetic to the parasympathetic. But you're significantly going to influence blood flow to your gut.
Okay.
Right? So the primary blood flow trigger switch to your gut is the vagus nerve. So the vagus nerve sends a signal down towards the gut for blood flow. So it's not just the gut going up. Now, most of the vagus nerve communicates with your organs in your gut via where signals come up from the organs and up from the gut. It's called afferent, ascending, up. So 80% of that nerve is signals going up. So it's really important that you have organs that can move well. That's one of the things we'll get into, why breathing is so important and why organ visceral manipulation or massages can work so well for people that I do a lot of. So the signals come up, but you also have signals that come out. So you have about 20% that comes out from the vagus nerve and down. That's efferent, like exit. And that's the signal for the blood flow to the gut. So you can have a problem with the signals up, but a lot of people forget about the signals going down. So that's why you have to, when you work vagus nerve work, you can do stuff down in the abdomen, but you also have to do stuff up in the neck and the skull to affect it higher up. And if you have poor vagal tone, you'll have poor blood flow to the gut. And the gut, kidneys, and brain are the three largest sources of blood flow in the body. And when you decrease blood flow to anything, guess what? It freaking hurts, because you can't get nutrients and supplies via the gut, and it can't get oxygen. And whenever you have low oxygen somewhere, you're going to have pain, period. I'm going to stand by that until I'm dead. Well, because your cells can't breathe. I mean, that's pretty stressful if you think about it. If you have a couple of billion cells that can't breathe, well, that's a big stressor to your nervous system, right? And let's say 70, 80%, I bet you this number is going to go up with research, of your immune system strength is in your gut. So when you have compromised blood flow in your gut, you're going to have a compromised immune system. And then you get inflammation that goes crazy and haywire. And then we talked about it last time, that the majority of your lymphatic system, which is the biggest part of your immune system that's supposed to kill stuff that's inside of you that you don't want, guess where it lives? Right in the gut. So, there's no accident that all these things were engineered that way, but by the body. And what's interesting, that they're finding that a lot of these toxins, sometimes they're finding Epstein-Barr, they're finding mycotoxins and bacteria. They use the vagus nerve as a conduit to enter up into the central nervous system and the brain.
Okay. So with all that in mind, you've started to, I guess, give us some clues in regards to how we can modulate vagal tone and support the vagus nerve. So is there anything else that you'd like to touch on before we start thinking about how we can actually improve vagal tone?
Yeah. So, honestly, you could talk about the vagus nerve for a week straight and probably not get anywhere near what you want to talk about it. Or, the limited information that we actually know about it, to be honest with you. But I really want people to remember just how far that connection goes, because the pathway from the vagus nerve, has to exit the skull, and it exits the skull through an opening that's called a foramen. Foramen just means fancy word in medicine for opening or hole. And it's called your jugular foramen. And it travels down from there out of the same hole with a couple of other nerves and a big vein called your internal jugular vein, right? And that drains the toxins, the metabolic waste from your brain. Then it comes down the side of your neck, and it enters the torso right at the collarbone. So you have a right one and a left one, and it comes down. And that's why a lot of people who have excess tightness or tension above the collarbone with tight traps, or they don't have very good breathing patterns and they're really tight at the pec and the chest, they can irritate that nerve and the blood flow around that region and have vagus nerve issues. Then it comes down and wraps around your esophagus that travels behind your sternum. And then it exits right at the stomach, where the esophagus drops into the stomach, and then it wraps all around the stomach right by the diaphragm. And then from there, it spiders off to the organs, goes to the right side and goes towards the left side. And there's places where what I teach and what I find in people is that the nerve is very vulnerable at certain spaces through these openings and through these changes where the nerve enters different body cavities. So the big places where the nerve can have an issue, from tightness or tension in the body, it could be you have soft tissue tightness, muscle tightness, fascial tightness, which is the connective tissue of the body, or maybe joints that get stuck and don't move as well as they could from lifestyle habits. But one is that as it exits right at the skull, so right at the top where the skull joins the cervical spine, is one of the biggest places that nerve gets an issue. All right. And we'll talk about how you can help that later. And another one is going to be actually right at the top of the neck, behind the angle of the jaw, at what they call cervical 1. That's where the largest lymph node in the neck sits. And we talked about that in the prior. So that's number 2. Number 3 is at the collarbone, above the collarbone. That's number 3. And then number 4 is right at the bottom of the sternum, right as it enters into the stomach at the top of your abdomen. So those 4 places, the vagus nerve can get twisted, turned, kinked, poor blood flow, and it chokes off the tone in either one of those places. And I'm going to tell you now, if you look at the average posture that a human being assumes today, you choke off all 4 of those places for hours and hours and hours on end, right? And then you get a vagus nerve problem.
Wow. Okay. And would that be, if you, with sort of the work that you do, Perry, sort of palpating those areas because of what you said earlier of lack of oxygenation and nourishment creating
Yes.
pain, I'm assuming they're going to be very tender points.
Yeah, absolutely. And you can do a lot of work with the vagus nerve just from manual work on yourself, because you can take care of these places on your own, or for someone else, because we talked a little bit before, but tight tissue influences how well things move, right? Because if things are really, really tight, you're not going to get a lot of movement in it, right? So tightness and tension is a protective strategy of your nervous system to protect you. All right. But it also chokes off the fluid flow of the body. And that is arteries and veins. And then the cerebrospinal fluid, which is the fluid that coats around the brain and around the spinal cord, and your lymphatic fluid. Right? And those affect how nerves function, because tight tissue, nerves need to slide and glide in between tissues. So you don't want nerves to be stuck in a tissue. And you don't want them to be compressed from tightness and tension, because nerves don't like direct pressure. They like to slide and glide and move. That's why techniques they teach in physical therapy called nerve glides, gliding a nerve, helps you feel so much better, right? And nerves are really freaking long, and they're all interconnected. But when you have excess tightness and tension, you tighten tissue, but you decrease the flow of blood to a nerve. You decrease the waste from the nerve, and you decrease the fluid, how the fluid moves around the nerve, and you starve the nerve. And from what? Well, oxygen and nutrients. And when nerves begin to die, they become really, really super sensitive. And they start to tell you that they're not happy by you usually getting tingling and numbness or pins and needles. First thing I think with tingling and numbness and pins and needles is poor blood flow and suffocation from somewhere. And you got to find it. And why does that relate to the vagus nerve? Well, the vagus nerve has its own blood flow and vein flow and lymph flow all around it. So it can be affected. But you have all this excess stress from the sympathetic nervous system being all on all the time, what they call sympathetic dominance or sympathetic hypervigilance, which means that, dude, I'm not resting at all, because if I rest, I'm dead. And then guess what happens when you're in that state? You overbreathe, you hold your breath, you get excess tightness and tension, and then you feed the dragon. So the baby dragon becomes a big giant one over time. And a lot of times, just doing some of the simple vagal nerve stuff that we can go over later, like gargling and singing and cold and stuff like that, is not enough, because you need to go directly after some of these areas where the tension and tightness is so intense that you have to release it, right? So that's what.
So you have the function of the stomach as a whole. If you look what actually tells the stomach to do that, it is the enteric nervous system, okay? It's the nervous system. So there are messages which are sent from the brain through a nerve, which I'm sure many of your listeners are familiar with, called the vagus nerve. And this is let's say a function of the parasympathetic branch of the autonomic nervous system. So the stomach, knowing how to do that at what times, knowing how much stomach acid to make, knowing how much to propel food when it needs to, knowing when to open and close the sphincter, is coming from the brain. It's coming from the brain through the vagus nerve, okay? Same thing in the intestine. So the release of bicarbonate of enzymes from the pancreas, the propulsion of food through the small intestine, the development of immune cells at the intestinal barrier. In fact, even the intestinal barrier itself is dependent on messages coming from the brain to the vagus nerve. Okay, through the vagus nerve. And the vagus nerve is basically connecting, it's like a tendrils all throughout the enteric nervous system. And the nerve bundles are so dense. Some of the densest nerve fibers are in the human gut. And there's this concept that, you've got 80% of information potentially going up from the gut to the brain rather than from the brain to the gut. But honestly, I think that the amount coming from the brain to the gut has been understated, or the importance has been understated, and for this reason. So something that I'd really like your listeners to appreciate is that every single function of digestion, bar some of the autonomous things like the migrating motor complex, every single function of the digestive organs, and this includes the release of bile from the gallbladder, this includes the propulsion of food right the way throughout the intestine, every single one of these things is dependent on messages traveling through nerves from the brain, through the vagus nerve to the gut. Okay. And here's the thing is that if there is anything which blocks or prevents those messages from being sent, then the digestive organs lose the ability to know what to do. So you've got two main functions of digestive organs, right? You've got secretion and you've got motility or propulsion. Now, both of these functions begin to decline when, again, for whatever reason, there is an impairment of information coming from the brain to the gut. Okay. So this is what I consider the top-down approach, right? And this is where things like, meditation and all of this other stuff, which is a lot of these things are looking at improving vagus nerve function. So you have people who have high vagal tone or low vagal tone. And if you look at a lot of the evidence on inflammatory conditions, on IBS, there's a lot of digestive research, or let's say research looking at gastroenterology, which is specifically focused on improving vagus nerve function. And it shows positive outcomes. And you're probably familiar with a lot of that stuff. Vagal nerve stimulation, for instance, vagus nerve stimulation can radically improve inflammatory bowel disease. It can radically improve IBS and SIBO. There's a lot of people who know this. There's a lot of research that's been done on it. So that is very interesting. This is a factual piece of information that the vagus nerve is central to maintaining digestive function. So I'll give you an example. You have a patient come into you, and they say that they get chronic bloating, they're constipated, they've got low stomach acid. What's the first thing that you're going to be looking at? Usually what we're taught in functional medicine or nutrition, alternative nutrition, whatever you want to call it, we're taught, okay, do a gut test, do a stool sample, look for an infection, look for this, look for that, look for that. Prescribe betaine hydrochloric acid, give digestive enzymes. If they come up on their test, they might have low pancreatic function, or low pancreatic elastase, so you'd prescribe digestive enzymes. You also see that they've got high zonulin, so you see they've got intestinal permeability. So the first thing you think to do, I'm going to try sodium butyrate, I'm going to try L-glutamine, I'm going to do all of the, by the book, alternative things that you do to fix leaky gut. And again, that is a useful concept for symptom management. But what we're not taught to look for is, okay, maybe, just maybe, it's not a coincidence that someone's stomach is not releasing enough stomach acid. It's not a coincidence that that is co-occurring with their intestine also not propelling food at the right rate, or their pancreas also not releasing enough digestive enzymes. I mean, again, there's a lot of coincidence theory, let's say. It's usually, if you see a patient like this, most of the functions of their digestive system have basically shut down. They require laxatives. And it's we don't ask the question. We automatically assume that it's because of the microbiome, that it's because of the gut bugs. Whereas we're not necessarily, I think, trained to look at, okay, is what we're looking at let's say a collection of symptoms which highlights, okay, the main central issue here is that none of the digestive organs are getting the right inputs from the nervous system. This is a higher level problem that we should be, considering, I think. And again, I don't want to kind of project too much, because that was just the way that I was trained to look at it. So I know that there's many practitioners who are branching out, and there's a lot of interesting research looking at this stuff. But for the most part, I was very disenchanted, or let's say, I wasn't happy with the results that I was getting with patients, where oftentimes they would go through multiple different practitioners. They would be put on, maybe they'd be put on antibiotics from the doctor. Then they might be put on 6 months of herbs. Then they might be put on a gastrointestinal restoration program or something like that. And oftentimes these people are like nomads. They go from one practitioner to another practitioner because actually no one can help them. And they come to me and they're like, well, look, I tried this for the gut. I've done this, I've done that, and did that. Blah, 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 blah. And so I say to them, I'm like, okay, well, maybe the problem is not in your gut. And they're kind of flabbergasted by that. But ultimately, this person is presenting with a collection of symptoms, which I think, at least in Lonsdale would have put it, and I've seen this play out in real life, what we're looking at is a form of autonomic nervous system dysfunction. Okay, is that we're looking at a faulty communication from the brain to the gut, and nothing that you do in the gut is necessarily going to fix that, because it's not getting to the root of the problem. And like you said before the call, no one is going to have a positive, a healthy microbiome if the gut is perpetually, if the actual intestinal tissue itself is perpetually dysfunctional for whatever reason. So there is that. So just going back to what we said, and again, I don't want to go on for too long here, but ultimately, I began seeing by chance that people would respond pretty miraculously sometimes within 24 hours to this treatment of thiamine, which I never anticipated. So what I did was I started digging into the literature, and it turns out that it was one of the first ever studies looking at induced thiamine deficiency in man. I don't think it would be ethical to do right now, but this was published in the 1940s. And what they did was they took six patients, they put them on a diet which was 1/10 of the amount of thiamine that you need. So it was 10 micrograms or something per day. And they follow them up. They kept them in a controlled condition. It was within like a hospital setting for, they put them in there for 3 months. And what they found was that what they were looking for at that time, they'd heard from the Far East, from in Japan, oh, there's beriberi, there's all of these symptoms that are going to occur. So they're looking for that and seeing how long it took for these people to develop those symptoms. They were flabbergasted. By the end of the study, no one developed those symptoms. No one developed beriberi. No one developed Wernicke encephalopathy, which they were anticipating. So they actually made the wrong conclusion. They said, oh, well, B1 can't cause this problem because these patients didn't get it. No, what they got instead, and this is where it gets very interesting, is they developed a collection of symptoms very early on that you would never associate with B1 deficiency. So really run-of-the-mill stuff that most of the people come to you to address. So for instance, insomnia, fatigue, muscle pain, body weakness, burning of the muscles, sometimes tingling, neuropathy, but that came much later on. But one of the most consistent findings that they found in almost everyone was that stomach output increased. So stomach acidity decreased. Okay, that was one of the first things. They all developed constipation. They all developed bloating and gas. Basically, I saw this, I was reading this, and I was like, SIBO, hypochlorhydria. What? This was known back in the 1940s, that one of the first signs of a marginal deficiency or a mild insufficiency wasn't beriberi. It wasn't this end-stage nutritional disease that everyone is looking for. No, it was run-of-the-mill common digestive symptoms, bloating, hypochlorhydria, acid reflux, etc. And so that was fascinating, because that was one of the first things that they found, and this was almost consistent in every single patient who only had a mild deficiency. It got worse as time went on, and they eventually started vomiting and things in the 3rd month. But what this demonstrated to me was that, okay, people can have let's say they can have a lack of this nutrient. They're not going to develop problems that are severe enough to make them go to the ER. And at the same time, some of the most consistent findings are these people develop really run-of-the-mill digestive symptoms, which most people are taught to treat using probiotics and things like that. Whereas actually, what if we're looking at a situation where we have patients who've sustained themselves on a diet which is based on high-calorie malnutrition? We have people consuming junk food for long periods of time, and they develop adaptations. They develop adaptations to very low levels of deficiency. But what if we're looking? What if a lot of these so-called functional digestive conditions are actually a mild manifestation of an underlying thiamine deficiency? So I delved into it more. That's like when I said I started translating a lot of the research in Japanese, in Chinese, and it turns out that from the 1960s, they were treating constipation, they were treating acid reflux, they were treating a lot of these functional digestive issues with thiamine and with thiamine alone. Now, some of the research in China would use a combination of thiamine within an acupoint injection. So they'd actually inject thiamine to the acupoint, and this would be sometimes more beneficial than giving it orally. But in Japan, what they did was they started synthesizing lots of different types of B1, and what they found was that different forms could actually increase the levels of B1 in the body to a much greater extent than ordinary thiamine salts. And this is where you get the forms like benfotiamine or TTFD. They were all developed or synthesized in the 1950s and 60s in Japan. Okay, and so they started studying this, and what they found was that these forms of B1, they could basically use atrazine, which is one of the methods in which they would study constipation, artificially induce constipation in animals, and then they would give different forms of thiamine, and they would find that certain types could completely remove the block that atrazine had on constipation. And it worked by enhancing the release of acetylcholine at the neuron level. And this is something I haven't spoken about, but because thiamine is so central to the production, is necessary for the production and the release of a neurotransmitter called acetylcholine, this is probably how it is working for digestive conditions. So let me just give you a very brief overview, is that what I believe and what I think the research substantiates is that sometimes IBS, SIBO, chronic reflux, basically any function of hypofunction of the digestive system. So if there's a lack of secretion or if there's a lack of motility, and I think most digestive issues fall under that category. Most of the people that you would see if you're not a gastroenterologist, let's say. But so if there's a lack of secretion or a lack of motility, it is usually because there is a block or there is a reduction in nerve firing from the vagus nerve or from the enteric nervous system to the cells itself. Okay. Now, if we look at what the enteric nervous system uses along with the vagus nerve, what do they use? What neurotransmitter do they use? They use acetylcholine. Okay. Acetylcholine. So acetylcholine is known in the brain for improving memory or cognition, and that's one of the reasons why cholinergic drugs are being used quite successfully in Alzheimer's dementia. But if you look at what it does in the rest of the nervous system, well, it's the main neurotransmitter used by the parasympathetic or by the vagus nerve, okay? And the vagus nerve is the thing which is telling the digestive organs what to do. So in someone who, for whatever reason, does not have enough B1, or someone who, for whatever reason, does not have enough of the cholinergic neurons, cholinergic signals being passed through that information highway, then B1 is potentially working by enhancing acetylcholine at the level of the digestive organ itself and at the level of the vagus nerve. And it turns out that some of the early findings on vitamin B1, even if you go into the Japanese literature, there's a gem of a book which was published in 1960. It was translated into English, but it was all of the Japanese literature that had been done up until that point. And what they found was that in many cases, B1 deficiency, not only could it cause, or one of the main presenting symptoms, not only was it low stomach acid, but it could also be high stomach acid. And that was very interesting. And they surmised that it was basically not necessarily just a lack of information or a lack of nervous system signaling from the brain to the gut, but also faulty signaling. So for instance, you may have excessive signals going in one direction and faulty or inhibited signals going in another direction. And this is where it gets to using this clinically. It's where it gets very interesting. But basically what I've learned is that some people can present in opposite ways and both suffer the same problem, the root cause, which is basically a lack of nervous system signaling, but it can go either as excessive function, so for instance excessive motility or impaired motility, excessive stomach acid output or low stomach acid output. And so it's very interesting, and it seems to come back to nervous system regulation. But even the early research on animals and in humans, they found that one of the first things that tends to go when someone is mildly deficient in B1, not only the digestive function itself, but the vagus nerve. So, and this is where it comes back to this broader umbrella of dysautonomia, which is what Lonsdale specialized in, is that if you lose proper control of the vagus nerve, which is what happens and is one of the first consequences of a lack of B1. If you lose function of the vagus nerve, then not only can you not control your digestive system, but many times you also can't control anything else. So this is where your people who have POTS, who have issues with circulation, their blood vessels don't dilate and open properly, they can't regulate their body temperature, they might get dizzy, they might get orthostatic hypertension, they might have excessive fatigue, or they might feel excessively jittery. So their sympathetic nervous system is in overdrive, or their parasympathetic nervous system is in overdrive, because they're not able to shift effectively between one and the other. And ultimately, if you look at the underlying the driver, many times it is a lack of B1. And I think it stems back to this concept of high calorie malnutrition. Many of your clients, or many of my clients at least, have gone through decades of consuming junk food, and they decide to start on a healthy diet, but that's not necessarily going to resolve, 15, 20 years of abuse to their body. And there are also many other things. If they have some kind of an underlying disease process itself, that may be inhibiting or blocking the utilization of B1. And so we end up with the same principle, that their vagus nerve stops working and that they can no longer make the right digestive their digestive system stops working. And so the symptoms that you might see, and if you look even for something as benign as acid reflux, that can in many cases be one of the first signs of an underlying B1 induced or B1 deficiency induced dysautonomia, simply because every single sphincter is being told what to do. It's being told when to open, when to close. Like I said, there is this coordinated set of events, which is miraculous when you read about it and you wonder, like, how the hell does this happen in real time? This is like instantaneous stuff. It's crazy. The waves of contraction, the way that the stomach moves is all in like it's like an orchestra of different events, and it's just beautiful and miraculous and amazing that it can even happen. But ultimately, it only happens if there's the right signals coming from the nervous system. And if you lose that, then the sphincter just simply can't close. It's like, yeah, okay, well, we'll open it this time, and then we'll close it this time. Or, yeah, okay, well, we don't know that the food in the stomach is meant to go into the small intestine. So it's just going to sit here. That's one of the reasons why you have people who have food which literally just sits in the stomach, and they have to do like maneuvers and stuff to get it into the small intestine. It's like, well, rather than just giving hydrochloric acid, which can come in handy, why not, in these people, it may actually be that they're just not getting the right signals. So maybe if we try and enhance the signals, this can help. I hope I hadn't gone too long there.
System, right? That vagus nerve that we talk about so often with stress and trauma, and the ability to build resilience and be in a state of safety and a sense of calm. That vagus nerve is dependent on the photonic information it receives from the sun. It is the main driver that sends out that information. And what does that mean in normal speak? That means that a photon of light hits our proteins in our retina. That oscillation, that vibration is transferred to the vagus nerve and spread throughout our biology, so that every single cell is tuned to that rhythm of the light in our environment.
I imagine we've got quite a long list of tools within our toolkit that we can start thinking about here ultimately.
Mm-hmm. Yeah, absolutely. And I think, as you mentioned, it really requires a holistic approach, right? Because it's not any one magic bullet that's going to do it. Because if you deal with one trigger or one complication, let's say the gut, but you're also not doing mindfulness work and stress management and all that, you're going to continuously trigger that same cycle from your external stressors, right? The vice versa is true as well. If you just deal with managing external stressors and your response to those, if you're not fixing the gut's going to continue to perpetuate the problem. So I think we have to talk about tactics that deal with both. And I think ultimately what I always like to talk to people about are things that are the simplest to incorporate, right? Because hey, I would love to be able to get into transcendental meditation and become a yogi-like person, but it's not going to happen, right? It's not part of my daily routine or personality. And it's just, and I'm going to have external stressors, just the nature of life and jobs and work and family, and I also don't have as much time to put into all of these really awesome practices. So I have to really focus in on the simplest things that I can incorporate, right? And things that will make translate to an effect. And so if I try to empathize with other people's positions and I look at myself and I go, okay, what can I incorporate in my life that helps with both of those approaches, right? So that's kind of the way I'm looking at it. And I do want to point out that we're releasing a new strain. It's called Bifidolongum 1714. What's exciting about this strain is it was discovered at the APC, as I mentioned. That's in Cork, Ireland, one of the world's renowned gut-brain research institutes. And what they found was that this strain was really abundant in individuals that had very good cognitive balance, right? So people that dealt with stress really well. And there's many ways of doing this. You could take individuals, hundreds upon hundreds of individuals, and you can put them through stressors, right? You can put them through video game simulations and all that create stress in people. And then you measure stress response and brainwave function, and you look for people that have a really great ability to deal and mitigate stress response, right? Both cognitively and then biologically as well, as can be measured through hormones and inflammatory signaling. And so what they did was they started looking at individuals that dealt really well with stress and looking at changes in or differences in their microbiome between people that did have very poor stress response. And what they found was a lot of these people that had amazing stress responses and tolerance had an organism living within their system, which is thought to be a keystone species, but it's called Bifidolongum. So Bifidobacteria longum. But there's a unique aspect of this longum that is not found in most of the longums. And it has this thing called an exopolysaccharide, right? So it's a polysaccharide covering. It's like a carbohydrate type of covering around the bacteria. This is not a common thing among Bifidobacteria. But it turns out that polysaccharide covering has all of these little tentacles and all that create a triggering effect in the anti-inflammatory pathways, right? So this strain has a very unique capability of bringing down the inflammatory pathways, upregulating the Treg type of pathways in the gut that directly impact inflammation in the brain. Right. So what they found is that part of how these people tolerate stressors better is that their gut is more robust in handling that continuous cycle of inflammation and stress hormone signaling, and that this strain played a critical role. So then, of course, the next idea is, can we take this strain and put it in people that do have stress issues, and will it change? And sure enough, once you deliver this strain to people who don't have it, and who have poor stress response, their stress tolerance increases quite dramatically. Their cortisol release in the presence of stress decreases dramatically. And one of the most exciting aspects of it for me is we saw a very significant shift in brainwave function, right? Most of these people went from being a delta wave dominant, right, where they're kind of amped up and kind of, frantic in many ways, to a theta wave dominant, which the theta wave is the flow state, right? Which is what we all want to get to, where you're really tuned in, your brain is working at high level, but you're very calm and relaxed, right? So we all want to get into that flow state, and there's all of these mechanisms to try to do it externally. But as it turns out, when you take this organism, it puts its host in the flow state, which is just mind-boggling when you think about it. Then, of course, as I mentioned earlier, stress is related to sleep quite intimately. Of course, it also demonstrated that your time to get to sleep reduced dramatically, so you fell asleep faster. The quality of sleep improved dramatically based on REM analysis, and then that theta brainwave stayed throughout most of the sleep cycle, which then has an anti-inflammatory repairing effect on the body, all from this one organism in the gut, right? So what's exciting about that is you can really do a leap forward in dealing with these types of issues by just incorporating an organism like that into your system, right? So that's one big step that you can do. The second big step that's going to be really important is arresting leakiness in the gut, right? Because continuous influx of lipopolysaccharide, which is an endotoxin made by gram-negative bacteria in a dysbiotic gut, when that leaks through, LPS will actually migrate up the enteric nervous system through the vagus nerve, enter into the brain, and in the brain, it actually lodges itself in dopamine and serotonin receptors. So even if you're making adequate dopamine and serotonin, it's preventing the binding of it in the brain. So you're not getting the happy hormone and the satisfactory effects. So then what tends to happen is you're trying to trigger more dopamine release by doing things that you normally know releases dopamine, like eating food and doing things that excite you and so on. And that starts to lead to addictive behaviors, right? Because people are trying to release more and more and more dopamine, and people will find more extreme ways to do that, right? And then maybe going to recreational drugs or getting addicted to porn, whatever it may be, right? You get obsessed about it, you try to trigger more and more of it. So stopping the leakiness in the gut, and of course the spore-based probiotics do that better than anything else based on the research that we've published. And then of course, dealing with improving diversity within the microbiome. There's lots of simple things you can do with that, right? Number one is some intermittent fasting. Intermittent fasting can be really beneficial to increasing the diversity in the microbiome. A simple, 16-hour fast, mostly overnight. The 16-8 routine for me is a very easy one to keep up with. And that's something that I do constantly and have done probably for 4 years now. And then once in a while, I'll throw in a bit of a longer fast, especially if I've had a weekend of too much fun, right? And you need to really kind of give your body a bit of a reset. I'll do like a 24-hour fast or a day, and then go back to my normal 16-8. Getting out into the outside environment has a huge impact on the diversity of your microbiome, on arresting inflammatory signaling in your gut, and also helping with the leakiness of the gut. It's pretty clear when you get out into untouched environments. And I'm not talking about necessarily walking down the street as getting outside. You need to go out into a natural environment. And I always recommend to people to be prescriptive about it, right? Because we all know going out in nature is a good thing. I think instinctively we know, but we don't prescribe it to ourselves to do that, right? So I try to prescribe it in my routine where I go, 30 minutes, 3 times a week. It's from this time to this time that I'm going out. I'm going for a hike or a walk nearby, or I'm just going out for a bike ride in the woods. I like mountain biking in the woods. And so I try to prescribe it for myself because it's that important, right? And talk about histamine response. When you can get more diversity and exposure to the outside environment, things like histamine, mast cell responses and all tend to come down, right? So we see that in allergy and asthma studies that are being done on kids, for example. And then managing the external stressors, right? There's so many ways to do that. One of my ways is, and I think we talked about this maybe off the air, was staying away from news cycles and news sources, right? Which is an absolutely easy thing to do, and it'll make a big difference, right? One of the things that started early on when the pandemic kicked off is, of course, a huge polarization of opinions on how to go about things, what's happening, and so on. And if you go online and you start engaging in those threads or even reading them, right, it can create so much stress in you. And there's no beneficial end to it, right? It's not like through this Facebook argument thread that someone's going to come to some amazing conclusion, and everyone's going to be on the same page. No, it just keeps perpetuating, gets worse and worse and worse. And so I've stayed away from all of those kind of things, right? I just don't look at posts like that. I don't follow those threads. I don't engage in any of stuff because it doesn't come, there's no fruitful end to it. And same thing with, driving in traffic. I used to get really frustrated when somebody kind of cuts me off, but I try to increase empathy and go, you know what, something's going on in their day where they're in a rush, whatever it is. It's not like they're trying to victimize me, right? They don't know me. It's not crossing in their brain. But often if you feel like, what the hell, they're doing this to me, you feel victimized and you get angry about it. I try to pass those things off and be a little bit better about dealing with those. And then I do simple meditation apps, 5-10 minutes before bed, 5-10 minutes when I wake up. That's about the most I can do, but I find them to be quite beneficial to kind of start changing brainwave and mood and start reducing some of the central nervous activation. So, and then lastly, diet, right? So depending on what's going on in your world, the more diverse your diet can be, the better off your microbiome is going to be, and the less inflammation, less leakiness in the gut you're going to have. So if you can increase the diversity in your diet, that's something that can be really quite powerful over time. And when you add all these things up, right, if you are taking the right probiotic for leaky gut, if you're taking this 17-14 strain for the stress cycling management, if you're going outside 2-3 times a week, if you're eating a more diverse diet, if you're doing a couple of things to manage external stressors, when you add all these things up, it's really a profound effect on your system, right? Any one of those things by themselves may give you some benefit, but it's really about the additive factor of these simple steps that really will have a profound effect.
Brilliant. And I guess, thinking just out loud that the Bifidobacterium longum strain that you're discussing it falls within this category of psychobiotics.
Mm-hmm. It does.
So organisms that are influencing our psyche ultimately.
Absolutely, it does. Yeah, and what's interesting to note is that because it's a human isolate, right? What you see when you're screening people for it is that it it seems to be present in some people and then somehow eliminated or absent in other people, right? And one of the things we know from studying like the New Guinea tribes and all that, and this is hard to say in a modern population because our populations are so big, right? And the lineages are quite diverse. So it's hard to say the origin of these species and were they at some point present in most people and now they're only present in 10%. But what you see in the Papua New Guinea tribes, because their networks and their villages and all much more close-knit still, that certain beneficial organisms are present in everybody, in all of them, right? And we're part of the work we're doing is trying to figure out what those organisms do, isolate them, and figure out how can we get them back into our system, because we, through our practices, through monetization, through use of antibiotics and all of the myriad of things that kill microbes in our system and negate diversity, we've lost some of these organisms almost permanently. And so there's another organism, there's a lactobacilli strain that we've identified in the New Guinea tribes that seem to be present in everybody in all of their tribes at a very high level and absolutely extinct from modern humans who live in the developed world, right? And as it turns out, this organism seems to play so far a significant role in inflammatory pathology, which is again a big thing that we deal with in the modern world, but also in cognitive function. So not necessarily the stress cycling, but in alertness, awareness, memory, recall ability, all of those things, all of the things we're trying to use nootropics for. There are microbes within your system that are supposed to keep your brain in tip-top shape, right? And evolutionary, it makes sense. Obviously, those that have the right type of microbes and the right, balance will survive better. They're more, keen, they're more alert, they're more aware, they're smarter, they can figure out tools better, all of that stuff. So natural selection has driven that. But what we've done in the last several decades is we've eliminated a bunch of those types of microbes from our system because of practices. So part of our goal is like, okay, can we identify some of these ancestral bacteria that are clearly important for function that we've eliminated and get them back into our system, right? So kind of a rewilding of our microbiome. So yeah, and there are so many microbes in the system that are psychobiotics, right? That are natural psychobiotics, and we've really decimated them. And so it's no wonder that we have this increased crazy prevalence of psychological and cognitive issues.